Hello and welcome to this VetLit podcast. VetLit Minis are journal club podcasts on a range of topics, small animal focused, so you can keep up to date even if you just have a few minutes spare. Today we're going to be learning about transfusion reactions. So essentially reactions to packed red blood cell transfusions and plasma transfusions in dogs. To help us with that, we have George Hall, emergency and critical care specialist at DWR Veterinary Specialists in the UK. Thank you very much for joining us, George. Are you well?
Yeah, very well, thanks. Thank you for having me.
No, it's our pleasure. And I suppose the particular reason George is here, aside from her just being the bee's knees and capable of teaching us an awful lot, is that she's the lead author on a recent study published in JVIM entitled A Prospective Multicenter Observational Study Assessing Incidence and Risk Factors for Acute Blood Transfusion Reactions in Dogs. And I suppose to me, as a sort of an entry for you, George, the basis of this is that we might often talk quite non-specifically about risks of transfusions, be that amongst ourselves or to an owner, but how common are they actually? That's the basis, no?
Yeah. And I think that's the driving theme behind this whole project. And it was started way before I got involved with it with there's a society called the Association of Veterinary Hematology and Transfusion Medicine, who I think looking at previous literature on transfusion reactions and seeing that each study uses a slightly different variation in a definition for each transfusion reaction. So, for instance, a febrile non-hemolytic transfusion reaction might just be termed fever in one study, might
Hmm.
have very, very specific clinical criteria in another study. And I think they were trying to bring together a more precise definition with specific clinical criteria. And so they published this document called TRACS, it was basically a huge consensus document looking at different transfusion reactions, both trying to define them clinically and looking at ways in which we could maybe prevent or reduce these reactions in the future, as well as then providing kind of algorithms and flowcharts for how to deal with transfusions and treat them in terms of their reactions as well.
Yeah, so that's the background, isn't it? Because that study, those guidelines came out in 2021, if I remember the
Yeah,
track
yeah,
study, that tracks
yeah,
publication. And that's helped this study a lot, enabled this study, hasn't it? Because
yeah.
prior to that, lots of different definitions were used, and also this is the first study since that time, first big study since that time to use them in a prospective and in a multi-center way, and to capture really good quality data using formal new guidelines, which is it's a pretty cool situation to be starting out on, isn't it?
Yeah. So I think we got 14 centers involved across the globe. I mean, mostly the US, several in the UK, and then one Queensland University in Oz. So we're trying to kind of capture as much different information as, and different center information as possible in terms of how people give transfusions. And we gathered just over 1,500 different transfusion products being given to dogs alone. Um, and the cool thing that we did was we collected the data in a kind of online, it was like almost like a red cap kind of questionnaire form that we designed specially to try and capture and get follow-up information directly from these authors to try and, dig down into the detail as much as possible, but also collect it I guess, a collaborative and a systematic way.
Yeah, so the quality of that data and the reliability and the completeness of that data is pretty impressive. So if we say that you got over 1,500 transfusion events episodes, how do we break down some of the cool findings that you found?
Yeah, so we looked at lots of different blood products, but I think that the two really to focus on are the packed red blood cells and the plasma transfusions, mostly because they were the most numerous. So we had just shy of 900 packed red blood cell units and about 500 plasma units. And I think they're the ones because we have the most numerous data there. We have the strongest kind of findings from them as well. So, do you want me to go into?
Well, yeah, why not? I've got them here as well. So you got what 878 packed cell transfusions,
Yeah.
and we've got transfusion reactions total occurring in 8.9% of those
Yeah.
transfusion episodes. So then what were the most common reactions amongst those?
So within packed red blood cells, the most common were the febrile non-hemolytic transfusion reactions at around 4%. And then the second most common were acute hemolytic transfusion reactions, followed by allergic transfusion reactions.
Right. And then I think the one of the cool take homes I thought, I mean it's a small population that we'd be interested anyway, but absolutely no mention of anaphylactic reactions,
No, no,
which is
nothing at all.
I enjoy reading that because I feel like it's something that you quite often you're tempted to think about it as a risk, but as I understand it, there's also no actual evidence of that published
Yeah.
to date.
Yeah.
So it's pretty cool just to knock that nail on the head and say, don't really expect to be seeing those in these transfusions anyway. And I suppose the other, so we've got 4%, the most frequent transfusion reaction in packed cells was febrile non-hemolytic transfusion reactions, second, acute hemolytic transfusion reactions, and third, allergic reactions. And those allergic reactions, did they tend to manifest themselves? Because they were grouped, no?
Yeah, so in the new definitions, everything is grouped together. So whereas historically people might have reported cutaneous allergic signs as a separate reaction to acute and new onset gastrointestinal signs, in the new definitions, both of those clinical symptoms and syndromes are grouped together as an allergic reaction.
Yeah. And maybe just a side note here, I'll make sure the tracks guidelines are linked in the notes, but ultimately the cool thing about how they describe those no is that beforehand we had all sorts of weird and wonderful terms for describing transfusion reactions. The way they've described them is basically by saying here is a list of the most frequently encountered reactions clinically and describe them according to that
Mm.
previously
Yeah.
suspected frequency.
Yeah. Although they've also added in new definitions from the human world. So they've introduced this transfusion associated dyspnea, which is a new term to veterinary medicine,
Yeah.
which is effectively, I think, respiratory reactions that can't be definitively classified as either a transfusion associated circulatory overload or a TRALI, so transfusion related acute lung
Yeah.
injury.
Yeah.
So I
Yeah.
think we had a few of those, not many, but that's certainly the first time they've been reported because the definitions never existed for us before as vets.
Yeah. 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 And those just the order of the reactions that they describe in tracks is febrile non-hemolytic, respiratory, including those few that you mentioned, then the allergic reactions, then the hemolytic reactions, and then the lesser and lesser less and less common ones like transmitted infection and hypocalcemia, hyperammonemia, and hypotensive transfusion reactions. So if we moved on from packed red blood cells, well, should we think about the risk factors for developing a transfusion reaction
Mm.
amongst packed red blood cells?
Yeah, so I guess what we wanted to try and look at was to see if any of the factors associated with the units that we were giving and or the dogs were associated with an increased odds of these reactions. And ultimately, I guess the main take home for me from this study is that the age of the unit administered was associated with increased risk of all reactions, but when you broke that down into both the febrile non-hemolytic transfusion reactions and the acute hemolytic transfusion reactions. So for every extra day of storage, there was an increase in 6% of an increased risk in transfusion reaction overall for those.
And how do we deal with that? Because
Yeah, it's tough.
that's an awkward finding, isn't it?
Yeah.
But we
Yeah,
need to
and
recognize it.
I have seen on kind of LinkedIn social media things, people quoting this paper and saying we should only be giving young bags to dogs. And I think we have to be pragmatic.
Yeah.
It's a precious resource. I think generally speaking, people know what their rough blood requirements are per week or per month. And I think depending on how you source it, whether you run your own blood bank, like some hospitals do, or whether they source it from a essential, PET blood bank we have in the UK. I think it's about careful management, and not ordering in too much blood so that they go towards the older age of the units. But I also think that the percentages of actual reactions are still quite low. So although there is
Mhm.
an association there, actually the most common one was still the febrile non-hemolytic transfusion reaction, which in
Yeah, yeah,
dogs you manage quite safely, generally speaking.
yeah,
So actually, although it's associated, it wouldn't stop me using a bag of blood that's 40 days old when a patient requires a transfusion, and that's the oldest bag I have in the fridge because I want to use that unit that's been donated by a dog.
yeah,
I don't
absolutely.
want to throw it away in 2 days' time.
Yeah, yeah, no, I totally agree. And I suppose the other point that we might just fly through is also the leukoreduction.
Mm,
So there's been conflicting evidence previously, hasn't there, about the benefits or not of leukoreducing these units while producing a unit of packed cells from a whole blood unit. And in your prospective data, the leukoreduction was not associated with a reduced odds of a transfusion reaction occurring.
no, yeah, not any transfusion reaction, and the most recent publication just prior to us writing this was a retrospective that had shown that certainly fever was associated with non-leukoreduced units. So we're kind of counteracting that a little bit. I think if leukoreduction makes a difference, which again, even in the larger, bigger studies from human medicine,
Hmm.
there's still conflicting evidence.
Right.
I think the difference will be so small that the question probably is, what is the cost to us for doing it? Like, do we waste too much time, money, and the number of cells that get lost in those
Yeah.
filters? And is that worth it for a very small reduction again in a transfusion reaction that isn't
All
necessarily
right.
one that we
Problematic.
worry about hugely?
Yeah. Yeah, yeah,
Um,
absolutely. So then if we move on to plasma products, um,
mhm.
I found the beginning of this section quite interesting because you talk about the indications, the reasons given for using plasma products.
Yeah,
I think it kind of reflects changing attitudes, no, and changing attitudes or availability of colloids in general, because
yeah,
the most frequent justification for use of plasma in this study were colloidal and volume support.
yeah,
But I have the impression that if you were to do this study or were to have done this study, whatever, 10, 15, certainly years ago, the main indications would probably have been coagulation
yeah,
abnormalities. Would you
yeah.
agree? Was that
Yeah,
accurate?
definitely.
I think it probably reflects the loss of access to many of the colloids that you used to once use, and maybe our sort of changing approaches to volume resuscitation and more proactive use of vasopressors, and avoiding crystalloid administration. Maybe that's all those things combined mean that we're using um, natural colloids a whole lot more readily. Um, Plasma reactions, though. So,
Yeah. So, I mean, most of these were allergic in origin, which I think the nice thing about this study is it did reflect what I feel like I'd experienced clinically. I feel like if I'm going to give a plasma unit and the dog is going to have a reaction, it's almost certainly an allergic reaction from what I feel like I've done in the
yes, but
past.
that's the difference
Yeah.
between me and you, George. You knew that was coming. I needed this study to see that. So
Feel like I've just had some worse night shifts, maybe. Yeah, I think yeah, so most of them are, so 4.5% was the overall reaction. I think 3.2% from memory were the number
yes,
of allergic reactions, and then a tiny number of febrile non-hemolytic reactions. But there were far fewer plasma transfusions, and so the total numbers were 24 total reactions, I think.
right,
Um, but yeah, most of them were allergic, and of those, most of them had their transfusion paused, and an intravenous or an intramuscular, depending on which country you're in, dose of an antihistamine given for the cutaneous ones, and then everything restarted.
right,
Um, so most of them finished their transfusions.
cool. So I suppose my other, aside from my pondering about not documenting any cases of anaphylaxis, I had an interesting I thought another of your findings was particularly interesting because in your acute hemolytic transfusion reactions, if we go back to the packed red blood cells, you had 21 of these documented, and a couple of interesting points, but 10 of those were febrile as well. Now, I suppose to me, that's just a reminder that your acute hemolytic your febrile non-hemolytic transfusion reactions are very much a diagnosis of exclusion. You do have to go through this tick box exercise to say, oh, I don't see evidence of respiratory distress, and there's not a strong case for there being a septic focus. I'm going to label it as a febrile non-hemolytic and then set it aside. Or I don't see evidence of an acute hemolytic transfusion reaction, strictly speaking. But there were some other interesting findings amongst those 21 dogs because not all of them had clinical evidence of what I've always thought of as being the worst case scenario, a real explosion of hemolysis and inflammation and clinical deterioration and the worst possible situation. But that didn't seem to be the case.
No, so yeah, I agree. These are the ones that we really worry about and have to warn owners about, even though we don't see them very frequently.
Yeah.
But yeah, of these 21, 6 of these were picked up purely on the fact that someone had taken a PCV relatively shortly after a transfusion and found that the serum was then hemolyzed in colour, having been normal prior to the transfusion. And of those 21, only 3 had kind of the cardiovascular deterioration that we really worry about.
Yeah.
And yeah, so it is it's very interesting, and I think probably on reflection, I think certain not even within centre, I think certain clinicians probably the shift that was going on, whether how thoroughly people investigated these febrile ones, probably I think in very thorough situations. So, where I used to work with you at the RBC, we have a very, very strict protocol of if the temperature spikes, you do stop the transfusion, and our nursing team are fabulous and will take the blood already and screen for hemolysis before, we've been even made aware of the case in certain situations. So I think the ability to pick up on these acute hemolytic transfusion reactions will vary dependent on time, center, and the strictness with which a protocol's followed. I think the other thing that is interesting is I suspect, given the strength of association with old blood, or older units of blood, is that a lot of these acute hemolytic transfusion reactions, given that we're not seeing that explosion of inflammation that we worry about, are more likely to be non-immunologic in origin than immunologic.
Right.
And so I think I would still stop the transfusion, but I guess from a systemic point of view, as dangerous as intravascular free hemoglobin can be, I guess it's not that overactivation of your immune system and deterioration that we'd worry about from that point of view. I think it's more that the red cells have either started to lyse in the bag, or the method of administration going in has caused the lysis potentially.
Yeah, that's a really nice way to sort of to bring together two of the biggest or two pretty big findings from your study, isn't it? I like that idea, especially because the correct me if I'm wrong, but the non-immunologic lytic reactions are very poorly described. We don't really have any data on those at all, so it's pretty cool if that is it's a can of worms. Let's just call it that, shall we?
Yeah, I think it's tricky to interrogate further.
Yeah, very rational, very sensible conclusion there, George. Thank you. That's actually it for today. Thank you very much for joining, George. Do you think we've covered everything?
I think so, yeah. Thanks for having me.
Not at all. Our pleasure, as always. So the aim of VetLit is to make veterinary literature both more accessible and accessed, and hopefully we've secured that in some small way today. Remember, you will almost definitely find an article to read that interests you on the vetlit.org site. Check back here, there, or via the email updates for more, and otherwise have a great day. Let's bye-bye for now.
Bye-bye.